Listen, go home, go clean out that old room, go clean out the basement, go do some laundry, go grocery shopping, make a few calls around the area to see if you can get your family member a job. We're about to wake them up. They're coming home. We're talking today about the Coma scam. This is a shocking one because it is a scam. Your family members do not need to be asleep right now. Let me go ahead and say this early. Even with the injury, sleeping for months to years is not natural. Let that hit you hard. Nobody has an injury bad enough to make them sleep that long. It is a scam. The longer they are sleeping, the more money the company gets. Okay, so if my theory is correct about this, then I think more states should consider bringing back the death penalty. Because in my opinion, this would deserve the death penalty. So let's get into it. Now, we know there are many ways that can induce a coma state, like a stroke or, say, a head injury, maybe from like a car accident. But there's a very dirty, sinister industry secret that a lot of people don't know. And that is, if you ever have a family member or patient in a coma, you should always get them checked for heavy metal poisoning, especially a common one would be mercury poisoning. Oftentimes, when they're asleep for such a long time, they have a lot of metal, again, commonly mercury, maybe even lead, but they have a lot of metal in their bloodstream, and it's keeping them down. It's keeping them in the state of basically, and some cases, loss of consciousness. We'll get to that. But yeah, get them checked for metal poisoning. You're going to wake a lot of coma patients up. They're probably going to run them through like dialysis. They're going to maybe get them on chelators. Those are medicines that help remove metals from the blood, away from the brain and the kidneys, etc., etc. And that could take some time. It could take maybe weeks or months or whatever, but you want to begin cleansing their body of metals, because that can keep them in a coma state. All right. Oh, the things they would do to make $1, make you lose months and years with your family. Because again, a lot of these corporations, they know this exactly. They know, hey, check for metal, check for mercury. They got to make that $1. Let me tell you a secret I know. I call it the poor man's lavish, and maybe it's not, but I often keep alcohol around me. I'm not like a heavy drinker or anything, but I use alcohol as medicine. Alcohol will lavish. It will clean a lot of things out of your system, like metals, like meth, like sulfur. If you want to clean your system, a few shots. You take a couple of shots. If you suspicious that you have a lot of metals in you, if you eating a lot of fish and you kind of feeling some kind of way, just take a bunch of shots or go through a case of beer or something. I mean, don't be puking now. Don't be throwing up. That's too much. But alcohol clings on to a lot of metals and you're just urinated out. So that's a good way a quick way at least to clean your body of metals. But again, a lot of your coma patients are sitting idle, making a corporation money just because they have metals in their system, and they need to be cleansed. They need to go through that lavishment. And I'm telling you, that's going to wake a lot of people up. And you're going to have a lot of people wanting to sue. I'm just saying, a lot of these dirty practices the medical industry engages in, they have to be outed. Somebody got to out them. Somebody. And if you see what I'm doing here in Lear, the Lottoriddles Institute of Health Research, you can now tell how mad COVID made me. Because a lot of this ambitiousness, a lot of the drive I have is because I hated going through that COVID era. They're going to have to pay for that. They're paying for it right now. They're not about to pull anything like that again. I had a horrible time during COVID. And so if they're listening, and they probably are, this is their result. They finna get this over and over and over again. Let me be clear. The COVID scam. So drink some alcohol, let it flush all of that mess out of you. What I want to talk about now is something very horrible. Is I was researching a lot of cases of people in comas. I'll probably put a link in the description, but there are a lot of people in comas who are actually conscious. Now, they're going to say some form of conscious. 1 in 4 people, I think, have some form of conscious. Yeah, but some of them have full conscious. There's popular cases like there's a guy, Martin, what's his name? Martin Pistorius. I think he authored the book Ghost Boy. I think he's the most popular case. And I think he was in a coma around 12 years. 8 of them were conscious. They called that a living nightmare. Can you imagine being conscious for 8 years in a coma? If you watch my other site, Lottoriddles Intel, I talk about how a lot of evil people will be entering the void state, like your Illuminati types. That's the closest thing I can try to get you to picture as far as what a void would be like. They're literally trapped in their own mind. They call it, they call it a living nightmare. They call it locked in. So when you look at a coma patient, if they're in a locked in state, they literally are trapped in their own mind. I think of sleep paralysis, where you can't move your body and you can't. You can think. That's about the only thing you can do. There's no visual. There's no control of your body. A demographic of these coma patients are in a locked in state. And all you would have to do is rid their body of metals in some cases. That's sinister, man. That's death penalty worthy, at least in my opinion. All right. Look up locked in state. Trapped in their own mind. I was doing a bunch of research. It was a bunch of military vets who was in this situation, trapped in their own mind. That is a living nightmare. So we got to wake a lot of people up, because we can do something about it. When I was looking at the Martin guy, he even explained how he was misdiagnosed. Now, one of my other videos, I talk about one of the most common scams in the medical industry is misdiagnosis. And I guess I would say this: not always what I mean is not always the doctor getting it wrong, but the company intentionally misdiagnosing certain things to keep people sick and make money. You're going to hear a lot more about that from me. That may not be his case, but I'm just saying you're going to hear a lot more about misdiagnoses, because that's a big one. All right. It could be a little bit of both. I don't want to paint all doctors as saints. Look, I always forget something. I'm like, man, I can't believe even when I write something down, I'm like, I forgot to put it in that video. If I have anything else, I'll put it out later, but I'm gonna leave it at that for now. That can be heavy in itself. So this is Charmaine Santier, Lear Liar, Lottoriddles Institute of Health Research. Come back and see me. I'm gonna keep laying it on thick. All right.